Thank you, Mr. Chairman, and thank you everyone for being here for my presentation. We have been now, studying thymoquinone as an agent to actually prevent and probably treat sepsis in animal model. And we have done quite a series of work looking at the dynamic effects of thymoquinone in septic model, as well as trying to characterize the pharmacokinetics behavior of the compound in vivo in animal model as well. So just to start now with an overview of sepsis and septic shock. You probably know that sepsis is a sequela of presence of a microorganism, usually a bacterial microorganism, inside the body that has been, failed to be controlled by the body immune system. That could result in a different sequelas, including failure of body organs, dysfunction of the immune system, as well as death in many cases of patients that have been diagnosed with sepsis. When you look at the incidence of sepsis in intensive care units, you could see that sepsis actually exceeds the number of patients that have been diagnosed with congestive heart failure, for example, breast cancer, some other cancer, as well as the mortality of sepsis is quite high, resembling a mortality coming from acute myocardial infarction. So it's a serious condition that has been seen in intensive care units and been, around for many years. And in general, the basic principle of sepsis and septic shock starts by the invasion of the microorganism of the body structure. Usually, it's a gram-negative, but you could also have a gram-positive bacteria causing sepsis. Once the microorganism is inside the body, it will start triggering, different immune cells, including the monocytes and neutrophils. And if the immune system fails to control it, it will lead to an activation, wide activation of the coagulation cascade. That could result in adhesion of different, clotting factors into the endothelium, and that would result in eventually of a dysregulation of the circulation in the blood vessels and the microvasculature in general. So the hallmark of sepsis can be summarized in the following: presence of an inflammation and immune dysregulation, a vasodilation, and loss of circulatory support of the body organs. That could lead to ischemia, cell death, and eventually organ dysfunction. So it would be nice to find an agent or a compound that would trigger all these three different, stages of sepsis, whether we're talking about the vasodilation, the immune regulation, as well as the dysfunction or endothelial dysfunction of the body organs. So currently, what physicians are trying to do, and other healthcare providers, in trying to set up strategies for combating sepsis in patients that have been diagnosed with sepsis, is to follow a certain protocols to treat sepsis. This will include optimization of organ perfusion through a given fluids, for example, a vasoconstricting agents to help with the blood pressure restoration, as well as respiratory support for improving oxygenation of body organs. The third one will be to treat patients with antibiotics. Usually, a combination of at least 2 antibiotics should be started initially empirically. Then, based on the subsequent result of the culture, this antibiotic regimen can be adjusted accordingly. There has been an interest in giving patients also with sepsis a low doses of steroids on the premise that steroid deficiency, particularly glucocorticoid deficiency, could contribute to the outcome of sepsis. And more recently, a new compound has been introduced in the last maybe 5 or 6 years to treat sepsis, especially those who are being classified as patients at high risk for death. And this interleukin alpha is basically a recombinant protein that will antagonize the effect of platelet adhesion and microcirculation dysfunction inside the blood vessels. So when you look at the results of using hydrocortisone therapy, there has been some interest initially in giving a patient hydrocortisone, again based on the premise of relative deficiency of hydrocortisone in the body of septic patients. And unfortunately, more recent data has been around suggesting that there is no big difference actually between those patients who are being given placebo or treated with hydrocortisone, which means that hydrocortisone therapy may not be the magic bullet to control sepsis, besides treating subjects with other modalities, including the antibiotics and fluid restoration or blood pressure restoration in those patients. So what could be done? Basically, thymoquinone has been a compound present in a black seed, and it's a simple structure, as you can see. It's a structure that has double ketone groups, which undergoes redox recycling, which means that the ketone group will be reduced to an allyl group. Then this group will be oxidized again to a ketone group. So it goes under this redox cycling, which we believe that's an important aspect of the way that this agent or this compound acts inside the body. When you do a simple, spectral analysis of the extract, you can see that thymoquinone is at least present in 50% of the whole extract, which means that it's the main constituent of the volatile oil extract of the Nigella sativa or black seed. So this has brought in our interest in this compound, given the fact that there has been also some data suggesting that this compound has an immunomodulatory effects and other pharmacological characteristics that would be probably helpful in treating sepsis. So we designed the experiment basically to treat animals with thymoquinone. Then we subject them to an E. coli inoculation. Then after that, we looked at the primary endpoint or the primary outcome of the experiment, which is survival of animals. And secondary endpoints were based on the measurement of organ dysfunction markers as well as inflammatory cascade markers. So this is what happened. Those animals who received E. coli only without treatment, you can see that the mortality is significant. It reached up to 80 to 90% death on those animals. Those animals who have been treated with thymoquinone, whether it's 1 milligram per kilogram or 2 milligram per kilogram, we can see that the compound reduced mortality by 80 to 90%. So this is also true for the LPS challenge as well as for the E. coli. So this indicates actually that the drug or this compound particularly does not act as an antimicrobial. It's rather act as an immunomodulatory compounds that can restore the immune dysfunction that animals will develop upon challenging them with the bacteria or the LPS. We look at also the different markers for the organ function or organ dysfunctions. You can see that improvement in the levels of liver function test measured by ALT, total creatine kinase level, which is also a measure of tissue injury, has also been reduced compared to controlled. Total lactate dehydrogenase, which is also another level for tissue injury or marker for tissue injury, has been also reduced. As well as albumin level has been maintained with thymoquinone treatment. When you look at the cytokines, you can see that TNF-α, IL-1, IL-2, and IL-10 has been also improved. In particular, TNF-α has reduced significantly on those subjects. So this, as illustrated here, that controlled animals have developed a significant spike of TNF-α with the treatment. This has been significantly reduced. Also similar for IL-1 and IL-2. Now, the next set of experiment we did was to look at the effect of thymoquinone on nitric oxide level, because it's known fact that nitric oxide plays an important role in during sepsis, as well as in circulatory failure that has been documented in septic patient. So what we saw that when we treated animal or challenged them with E. coli, you can see there's a big spike of nitric oxide level measured by the nitrite and nitrate level, and those animals who were being given, or they were given thymoquinone, you see that the thymoquinone has reduced significantly the nitric oxide level. This actually is very similar to those animals who also were treated with LNAM, and LNAM is actually a selective inhibitor of or nitric oxide synthase, which is the enzyme responsible for the production of nitric oxide. A similar picture also have been seen with TNF-α, IL-1, and IL-2 and IL-10. Whether you treat the animal with thymoquinone alone, or in combination with LNAM, or in comparison with LNAM, we can see that there's similar pattern actually of protecting or improving the cytokine levels, which indicates that thymoquinone could act through modulating the nitric oxide level on those animals. We also did a series of experiments to look at what happens if we isolate a mesenteric artery from an animal and we expose them to thymoquinone. And with this set of experiment, or the ex vivo experiment, we can appreciate the fact that thymoquinone treatment actually causes an increase in the contraction of the blood vessels, isolated blood vessels. This is in phenylephrine already contracted blood vessels. It does not affect it if the blood vessel has not been contracted with phenylalanine quiescent blood vessels, which means that thymoquinone acts in addition to the phenylephrine contraction to improve the contractile tone of the isolated blood vessels. This effect has been also proven to be LNAM dependent, which means, or nitric oxide dependence, which means that when you block nitric oxide, you basically lose the effect of thymoquinone on the blood vessels. Now we come to see that thymoquinone, because of this unique chemical structure, and if you compare it to a very similar compound, which is thymol actually is very similar to thymoquinone, with the except that it's missing the ketone group at one side of the ring, as well as it has the hydroxyl group instead of the ketone group. And when we compared the response to thymol, we didn't appreciate any contractile response to thymol as compared to thymoquinone, which indicates that it's a unique property for this ketone structure in thymoquinone. We further went to do some in vivo experiment when we treated the animal with thymoquinone without an E. coli challenge. Then after a while, we isolated the blood vessels, and we did an ex vivo experimentation after the induction of sepsis in vivo. We could, appreciate from this figure that those subjects who are given thymoquinone, they had displays the less relaxation response to acetylcholine, which indicates that there is an improvement in the contractile tone of those animals who are being given thymoquinone before the induction of sepsis. This is also true for LNAM treated group. When you block LNAM, which means that you're blocking the nitric oxide level, so you expect that the contraction or the relaxation will be less, and this is true. What happened? It's very similar to a thymoquinone treated animals alone. We wanted also to characterize the kinetic behavior of thymoquinone inside the body. So we treated animals, rabbit model in this case, with thymoquinone with intravenous and as well as oral doses of thymoquinone. And we basically calculated the basic pharmacokinetic behavior. And we came to the conclusion that this compound is rapidly eliminated after intravenous administration, usually follow a two-compartment model, while with a half-life of about 1 hour, while when you give it orally, the profile is slower. It has a slow absorption phase and a slower elimination phase. We actually believe that the compound follows the flip-flop model when the absorption is actually slower than the elimination. So what you're seeing here is actually, it's rather than an elimination process, and this is a combination of absorption and elimination. The bioavailability of the compound is reasonable. It's about 60%. And the protein binding is high. It's reaching 99%. So in summary, that the data suggests thymoquinone prevent the sequelae of multiple organ syndrome of sepsis by these following mechanisms: modulating the production of nitric oxide, reducing the inflammatory cytokines, and adjusting the vascular responsiveness. These three different mechanisms would together help in maintaining, the positive outcome of those, animals treated with the E. coli or being challenged with the E. coli. In addition, we also came to the conclusion that the compound has a rapid elimination relatively to a slower absorption following oral administration. And this would reflect on a flip-flop model that has been also described for other compounds previously. With that, I would like to thank you, and I will be happy to take any questions.
If I understood it right, you administered thymoquinone initially, and then the animal was exposed to E. coli.
Right.
So that means the use here is prophylactic. That means in real case, if I know that a patient has a tendency to develop sepsis,
right,
he has to be given that along with therapy in order to avoid any problems.
That's correct.
So how long this is prophylactic therapy?
We treated the animals with thymoquinone just 1 or 2 hours before, challenging them with the E. coli. So it means that, in fact, that the compound has to be maybe initially administered in the initial phase of sepsis, or more preferably, if you are expecting that the subject or the patient will go into sepsis, you can administer it relatively, a few hours ahead of time.
In the summary, you said modulating the production of nitric oxide.
Right.
But in the data, there is no difference between control and nitric oxide data. Take me.
In which data?
Go. Nitric oxide. Nitrate. Yeah, this one.
Yeah, so here what we have actually, we have different groups. This is a normal control. This is thymoquinone only. This is a nitric oxide level. So in sepsis, you can appreciate that there is a high production of nitric oxide in the body. Okay, when you treat them with thymoquinone, there is a significant reduction in in nitric oxide level. This is similar to LNAME treatment. LNAME basically is a selective inhibitor of nitric oxide. Thank you, John. Thanks.